Hi, my name's Dr. Ross Hauser. Welcome to Caring Medical Florida. I just wanted to go over this illustration. As you can see, it kind of looks like a bunch of mishmash, and that actually is what the nerves in the body look like. They are so intertwined. Most people don't realize, like, the cranial nerves are pretty much all connected to the autonomic nervous system, and specifically the vagus nerve. Like, the vagus nerve input to the body is mostly inhibitory, meaning that it keeps the adrenaline system or the sympathetic nervous system in check. So the vagus nerve has input to the cervical sympathetic ganglion, and by ganglion, those are these little outpouchings. That's where the brains of the nerves are located. And the brains of the vagus nerve are located at C1, and the brains of the cervical sympathetic ganglion is at C2. As I said, the vagus nerve input, a lot of it is inhibitory. It specifically inhibits the input of the cervical sympathetic ganglion to the blood supply. So when the vagus nerve is injured by C1, C2 instability, the sympathetic input to the blood vessels, for instance, goes unchecked. Well, that can cause vasospasm. So if you get vasospasm, say, of the ophthalmic artery to the eye, you can get darkening or black spots or grayness in the vision of just one eye. C1, C2 instability can also block cerebral spinal fluid flow. And when that happens, you get an increase in intracranial pressure, which can give you, again, a darkening of both eyes. It can give you double vision, as can vasospasm, and the ophthalmic arteries give you double vision. The good news is, once we stabilize the vertebrae, especially the upper cervical spine, and the vagus nerve starts functioning normally, the vision changes stop. And it's been quite remarkable to hear patients explain how their optometrist or their ophthalmologist is like, oh my gosh, the pressure in the eye is back to normal, how the vision has improved, how when they get glasses, they actually have to, the prescription actually has improved. And as you know, optometrists aren't used to this, but this is expected if a person has cervical instability, which of course we document with digital motion x-ray, and we correct the curve, and then we tighten the ligaments, and the input to the eye, the sensory input to the eye, of course, should get back to normal, and often it does. So this excites our patients, and it sure excites me.